obesity epidemic seems to be a major concern among our news media today. Most of you have probably heard those oft-cited statistics, how 33% of our nation is obese and 66% of our nation is overweight. When the Founding Fathers contemplated the expansion of America, I don't think this is what they had in mind. Yet, all this worry does little more than convey the notion that America is a country of fat people. And while at some levels this might be true, I believe our root cause is access to a nutritious, balanced diet. Studies have found that low-income and high-income neighborhoods differ in the availability of fresh produce. One Pomona, California researcher saw that 41% of food pantry clients have no access to fresh greens. Keep in mind, many of these families don't have a car, so they are limited by whatever convenience stores are within walking distance. Similar results were also found in Los Angeles, Detroit, and Chicago. Chicago's problem is slightly different, though. Their deep dish pizza is just too good. In Reno as well, the area east of the university is known for its low availability of fresh produce. In fact, this area is classified as a USDA food desert, and the nearest grocery store is half an hour's walk away. Of the 25 nearest places families can redeem their food stamps, not a single one is a full-service supermarket. Don't even think about farmers markets. All these families have are convenience stores. One of these stores in particular may be named after a Civil War general, but I can tell you, the food they sell here is less healthy than the hardtack biscuits and blue beef our troops were eating 150 years ago. Believe it or not, Fort Sumter wasn't stockpiling Twinkies back in 1861. I'm sorry if any of you are feeling a little shell-shocked. Besides, meager welfare benefits do little to prevent the purchase of cheap, unhealthful, and often starchy filling foods. The average national welfare benefit is just $133 a month. And to get those $133, you have to fill out a long form, especially in some states. Take a look at this 26-page welfare form, Texas style. All these factors put together place low-income families at a greater risk for obesity and related medical conditions, including heart disease, type 2 diabetes, hypertension, and strokes. This was my motivation when I founded Farm Fresh for Kids in January 2011. My initial goal was, and still is, to provide farmers market vouchers and nutrition education through low-income serving clinics. I realize that small farmers have been losing out to the convenience and prices of large supermarket chains since World War II. During suburbanization in the 1950s, small farmers just weren't able to compete in this new automobile-based culture. It is vital to support our small farmers, especially those who are pesticide-free and organic. Supporting them not only preserves our environment, but it returns money to the local economy. I realized that these farmers would benefit from every single dollar of fresh produce our families received. Farmers market vouchers programs certainly help both families and farmers, yet the main goal is often to provide nutrition education. Through these vouchers, kids can experience a form of active nutrition education and learn firsthand what fresh fruits and vegetables taste like. They can also decrease their likelihood of developing obesity. There's a common saying most of you have probably heard: an ounce of prevention is worth a pound of cure. Here, though, our doctors prefer to say an ounce of coupons is worth a pound off the waist. And these coupons can be made even more effective when combined with a kids page geared towards elementary school children, a nutrition pamphlet geared towards their parents, and other materials we place at the clinics. All of our materials are given out by a nurse, doctor, or nutritionist. These people are respected, and their advice is likely to be listened to. One concern, though, is that many families can't make it to the farmer's market. This is why it can be so advantageous to directly deliver produce to local schools. In our case, the produce that Nevada farmers supplied supplemented the non-perishables that kids were receiving through the food bank. With these two food sources, the kids were then able to achieve a balanced diet. Studies done of these voucher programs across the country have found numerous benefits for the participants. Not only are the families more likely to feed their kids fresh, healthy food year-round, but the kids themselves have a greater interest in consuming a nutritious and balanced diet. Extensive work is required to increase fresh produce access and decrease obesity, but the benefits of action are numerous. If we Nevadans can cut our average BMI by just 5% by 2030, we will save ourselves $5 billion. To accomplish this change, we'll employ a three-pronged approach involving community gardens, farmers markets, and medical clinics. In the first prong, community gardens, organizations like Urban Roots have started nearly a dozen community gardens at low-income serving schools throughout Washoe County. The usefulness of these gardens is backed up by a number of studies, one of which involves 40 Hispanic farm worker families. After just one season of gardening, the proportion of them worried about food security dropped from 31% to 3%. In our second prong, farmers markets, there's a growing trend towards using welfare in an electronic form. We can leverage this electronic welfare to increase fresh produce consumption through what's known as the Double Value Coupon Program. For every dollar of welfare a family spends at the farmer's market, a nonprofit chips in a second dollar. I don't think there's anyone in America who can resist buy one, get one free. Finally, in our third prong, medical clinics, organizations like Hawk and Wells Avenue Clinic are providing affordable sliding scale care to low-income families. These places are proving the ideal settings to focus on improving diet and exercise and preventing medical emergencies before they happen. There are many manageable steps we can take to increase access to fresh produce and improve the overall nutrition of low-income families. With our three-pronged approach, I am confident that we can decrease obesity levels and change Nevada's health for the better.